I am Jonathan Johnson. I am the Integration Software Architect for the Health Data Informatics Office, attached to the Disease Outbreak Control Division of Hawaii's Department of Health. My primary role is leading informatics and data science teams, as well as part-time development of our integration engine, which is called Rhapsody, and generally just defining future projects within a lot of informatics scopes. Maintaining the health and sustainability of the program, be it either grant funding, but really just trying to create a forward-thinking approach to what we're already doing and maintaining what we can from Epi side. When I think about the problem that I'm addressing and have addressed in the past, it's not really a specific instance. I would say it's a culture thing, right? It's the ability to blend what you would identify as disparate parts of our organization together. Notably, I would say this would be the technical sector and our epidemiology side. Or even to bring it out even broader, this is the division between folks who use the systems and folks who create systems. And how do we kind of garner that knowledge to be able to generate what we need to do as the next steps? Originally for us, it was the creation of our EDSS, Electronic Disease Surveillance System, back in, I think it was like 2010 or so. And it's called Maven. And when it was originally deployed, it really only utilized one side, the people who would use the system. And so what that meant is that it was created in such a way that it was useful to them in that time period. But it wasn't necessarily done with in mind for everybody else. We started looking at it from the sense of, if we go through that again, are we creating this system and other systems like it in a way that is going to be manageable for the future and health of the population of Hawaii? And how do we do that appropriately and responsibly? And so our program has always kind of been, and this is our Health Data Informatics Office, which is newly created. It's about a year old now. We have a great chief data officer, great informatics team, great EPIs as part of informatics, and great IT staff on that as well. And the biggest kind of push that they're doing is, how do we align ourselves on our day-to-day, right? How do we start where we're not asking people to the table too late, but at a time of need? Why it matters is there's people being affected by everything we do. You know, it's easy to think of it as a DOH as a microcosm of just people and facilities and systems that are doing these things, and we do really, really good work, but we do it with a purpose, right? And the purpose is always to serve the communities around us. And so that's kind of that guiding structure that should always be part of what we want to do next and how we should define what we're already doing. Because without that, I mean, we're public health, right? We're for the public, we're about the public. So the community has always kind of been in my upbringing and in my blood and in my culture. And even when I did computer science, I did human-computer interaction in Atlanta, which is the idea of using computational ability in computer science to uplift communities that maybe don't have access to these things. And public health really is an extension of that. And so while I never really saw myself as, you know, I'm going to be a programmer and I'm going to go to public health, now that I'm in it, I don't want to leave it because I know that it's that purpose, which is to support people around us. And that's kind of what I'm all about. And so as long as I can keep doing that and I feel like we're doing it effectively, then I'll be in it as long as I can.